Good afternoon. I was delighted to receive the invitation to appear here today, and I want to just start by apologizing very quickly for the fact that the connections out of here are not to my happiness, and I'm going to have to flee out of here probably a little bit before 4:30. I may have been overly ambitious in what I'm trying to present, and I may kind of take shortcuts through some of my slides just because I'm hoping that there will be a little bit of time for discussion. And if it is not with me, I've asked Glenn if he's willing to talk with you, because the kinds of feedback we get from here to the committee are going to be useful to us as we're still in the midst of shaping some of our other reports, and we're trying to be as real as we can in being useful as we consider the important charge that's been given to us. So just for those of you who are less aware of what the Institute of Medicine does, it serves as an advisor to the nation in efforts to improve health. It's part of the National Academies of Science, and the IOM conducts studies that are variously funded, frequently by governmental bodies, but sometimes by foundations, in this case by the Robert Wood Johnson Foundation. Big surprise here in this group. The studies are done for entities that are looking for guidance in the form of evidence-substantiated recommendations that represent consensus of committee of individuals who come with no particular axe to grind, and from an array of disciplinary backgrounds with content expertise, and asks them to try to come to some consensus about recommendations that can be forward-looking in shaping policy in years to come. So obviously today I'm going to talk about some of the work of this particular committee, and I'm going to basically give you an orientation to what our charge is, and then I'm going to go through some of the recommendations and the rationale for them that have emerged in our first report that was issued in December. And again, the discussion of implications, opportunities for public health services research, I hope we'll have a time to talk about, if not here in person, through some exchanges that come back and forth by the internet or by the telephone. So the overall charge of the committee from the Robert Wood Johnson Foundation was for us to explore the topics of measurement, law of regulations, and financing in the context of contemporary opportunities and challenges, and with the prospect of influencing the work of the public health system in the second decade of the 21st century and beyond. We were to prepare 3 reports containing actionable recommendations for public health agencies and other actors in the U.S. in terms of population health. Context for the charge, I think will surprise nobody here. We're first in the world in the United States in terms of medical care expenditures. We leave everybody in the dust. We spend 17% of our GDP that way, but we rank 49th in life expectancy. All of the brouhaha about medical care, I'm a physician, I don't mean to discount medical care, but I think many of the people in the room understand the relatively small proportion of health we will create by focusing our attention exclusively there, and we need to look to altering and making more favorable the broader conditions for health. Robert Wood Johnson sponsored this. The project is slated to run from fall 2009 to winter 2011. In addition to delivering 3 reports, the 2 staff members who've been working with us are delivering 2 babies, so our deadline is getting a little bit odd, but still, we're moving along. Our deliverables are 3 integrated reports on measurement, law, and financing, and so as we have laid out the discussions and the learning for the committee from experts who have come to present to us, we've tried to think ahead as to what we're learning about law that influences financing and what we're learned about measurement that will influence law. These things are obviously very interconnected. The committee's is made up of 18 members, and their expertise is sort of highlighted there. It's a very eclectic, multidisciplinary group. We do have lawyers. We've got a number of people actually who have been at this conference at different times, have been involved as committee members. Glenn, obviously, Les Beitsch is on the committee. Bob Kaplan, who I gather was here yesterday, is on the committee. Phyllis Meadows, who has been working with a number of you in this room, is on the committee. And we have a number of sort of local and state health officers who've been active in the national scene and at local levels, and we also have methodologists coming from academia. The list of folks involved is too numerous at this moment to go through, but committee is co-chaired by Steve Teutsch. Let me go through very briefly the language of the three charges for the three different reports, just so you get a flavor of the kinds of difficult issues we have been grappling with. The first, which I will go back to and which has been released already, is to review population health strategies, associated metrics, and interventions in the context of a reformed healthcare system. Now, of course, when this charge came out, we all were sure that there was going to be a reformed healthcare system. Now, I guess everybody's a little nervous about what's going to happen. The committee is going to review the role of scorecards and other measures of assessments in summarizing the impact of the public health system and how these can be used by policymakers and the community to hold both government and other stakeholders accountable and to inform advocacy for public health policies and practices. This was a very, very challenging report, and you'll see what recommendations we've come up with to try and move us along. In terms of law, a report that is scheduled now to come out in July. We've been reviewing how statutes and regulations prevent injury and disease, save lives, and optimize health outcomes. We are systematically discussing legal and regulatory authority, reviewing past efforts to develop model public health legislation, and describe the implications of changing social and policy contexts for public health laws and regulations. And finally, the funding report, which is obviously coming due in a very, very grim financial environment. We are to develop recommendations for funding state and local public health systems that support the needs of the public after healthcare reform. Let me just go through some of the recommendations and their rationale from the report that's already been released. I've written down this rather long website that will get you to the draft. I'm not sure whether the slides will be available. They'll be available, so you'll be able to find it there. But if you get to the IOM and you just look around for a little bit, you'll find our report. It's another way to do it.